Join me as I dive into the 12 biggest mistakes phlebotomists make on the phlebotomy certification exam and see if you can avoid them all. Mistake number 1. Inadequate review of material. Students may not thoroughly review the extensive material covered in the exam. It's important to study all topics covered on the exam, including anatomy and physiology, medical terminology, infection control, etc. Mistake number 2. Lack of hands-on practice. Phlebotomy is a practical skill, and insufficient practice with blood draws and specimen collection can lead to poor performance in the hands-on portion of the exam. Mistake number 3. Failure to seek help. Not seeking assistance when struggling with certain concepts or skills can impede learning and exam performance. Don't hesitate to ask instructors or peers for clarification on difficult concepts. Mistake number 4. Poor technique and equipment use procedures. Mistakes such as not balancing a centrifuge, improper needle placement, and incorrect use of equipment are common and can lead to errors in blood collection. Know how to use phlebotomy tools correctly. Mistake number 5. Patient and sample identification errors. Failing to properly verify patient identity and label samples can lead to serious consequences, including incorrect treatment based on inaccurate lab results. These are critical safety steps. Mistake number 6. Improper order of draw. Not following the correct order of draw for blood collection tubes can result in contamination and inaccurate test results. This is frequently tested. Mistake number 7. Poor time management. Pace yourself to have enough time for all questions on the exam. Mistake number 8. Not knowing uses for phlebotomy tubes. Make sure to understand which tubes are used for which tests. Mistake number 9. Neglecting to review challenging topics. Failing to review challenging topics like anatomy, physiology, and medical terminology can hinder your success on the exam. Mistake number 10. Uninformed about collection procedures. Lack of knowledge about special collection procedures and non-routine tests. Mistake number 11. Improper infection control. Failing to understand and practice proper infection control and safety procedures. Mistake number 12. Lack of adequate exam practice. Not taking enough practice exams to familiarize yourself with the exam format and types of questions. To avoid these common phlebotomy exam mistakes, thoroughly review all exam topics, get plenty of hands-on practice, take practice tests, focus on challenging areas, and familiarize yourself with proper procedures and equipment usage. By addressing these common mistakes, phlebotomy students can improve their chances of passing their certification exams successfully. Proper preparation is key to success on the phlebotomy certification exam. Don't forget to like, share, and subscribe to our channel for more valuable content on phlebotomy and healthcare careers.